My name is Yemurai Nyoni. I'm a Women Deliver 100 Young Leader. And I'm here as a youth participant in the forum to help shape the discussion on how we can improve reproductive, maternal, and newborn child health. I'm joined today by Dr. Kim Eva Dixon. She is Senior Advisor for Maternal and Newborn Child Health at UNICEF. Prior to her work at UNICEF, she was a senior advisor within the World Health Organization. She's worked on the global plan for elimination of new HIV infections in children, and she's also worked with the UK Department of International Development. Welcome, Dr. Kim. Let's give her a hand as well. Well, I have a few minutes, and we have a few minutes together, so I'll get straight to it. Under 5 mortality has reduced, it's said, by over 50%. And I want to try and get an understanding of what has worked that's fueled that reduction. At the same time, also what has not worked, that has not enabled us to reach full results.
Thank you very much. Can you hear me? Thank you very much. I'm really pleased to be here and to share the platform with you. I'm pleased that we launched the Every Newborn Action Plan today. And just on the question you asked me around under 5 mortality, what has worked? We have made great strides for managing pneumonia, diarrhea in children. We've made great strides in increasing immunization rates in children. The area where we've made the least progress is around newborns. And we know that now with the great reductions we've made, so over the past decade, we've been able to reduce under 5 mortality from like 12 million, we're now at about 6.6. So that's the good news. The bad news is the most vulnerable of children have been left out. And so now about 44% of the deaths are amongst the newborns. These are babies up until about 1 month of age. And they often talk about the power of a single story. So I'm very pleased, my sister, to hear your single story. But I'm pleased to also hear the impact that this single story made. And I hope that as we go on with this interview, I'll be able to highlight some of the things that we could have done to prevent such a tragedy of a story. And I sincerely hope it wasn't my hospital in Ghana where it happened. Thank you.
Okay, thank you, Dr. Kim. I know the Every Woman Action Plan is drawn from the Every Woman, Every Child Action Plan, and it includes a specific focus on reaching every woman and every newborn when they are most vulnerable. That's in labor, birth, and the first days of a child's life. I want to try and understand, there is a whole continuum of care that has to do with reproductive, maternal, and newborn child health. So why the specific focus?
Why the specific focus? The focus is because we know that at least 40% of maternal, newborn, and even stillbirths occur around this time of labor. So most of the danger is around this time. We also know that there are very simple things we could do around this same time. And also, what we also need to take into account is that not only do these complications happen around this time, but then they can die in seconds. You hear of a baby dying just like that from asphyxia. A mother could just suddenly start bleeding, and within minutes she's dead. A baby is born, and if you don't react immediately to help that baby to breathe, then the baby dies. So there are, we have most of the deaths occurring at this time. We have interventions that work, and that's why on this action plan we're talking about a focus. And also it's just a simple reality, we can't do everything. So we're not saying ignore everything else, we're saying let's do as much as we can, but this is where we'll get the biggest bang for our buck. We're saying this is where you could get like a triple return on investment. If you take time to focus on interventions around labor and childbirth, you can impact on the maternal death, so you can save a mother. you can save the newborn, and you can even prevent a stillbirth. So this is the reason why we have a focus in the plan. But we don't want to ignore all the other important things that need to be done, even to prevent a pregnancy that you don't want.
Okay, that makes a lot of sense. From an investment perspective, it's focused and it gives greater potential for faster results. And interventions, when they are more specific, allow us to really get what we need. But in terms of reaching out to and working with different constituencies, I'm a young person. I'm sure there are a lot of other young people in the room. What does this action plan mean for me as a young person, both as a beneficiary and as a potential actor within the action plan? What's your take on that for me as a young person?
I think for young people, it can mean a number of things. First, let me highlight on what are the issues or the particular implications for young people. When you read this action plan, what we also find out is that the youngest or teenage or adolescent mothers have the greatest risk. So most of the deaths occur around the time of birth, but the younger you are, the more risk you are at. So that's number one. Not only for the mother, but even for their babies when they're born, their babies are less likely to survive. So as a young person, you need to take note. But also, as a young person, let's look beyond the health the health consequences. For a young woman that gets pregnant when she doesn't want to, her education stops, there's so many other complications. So as a young person, I think we need to look at how do we support or work with young people so that we empower them to make choices that affect their future life. That's one. But then also, it's not only you directly. You live in a community. You have parents. You have community members. You're hearing something which maybe your parents may not have heard. How do you, as a young person, go out there and raise awareness? We've been in this forum. You've heard that babies die. There are simple things that we could do, and maybe I can expand on some of these simple things. So how do you then go out and work with other young people, work with parents, work with communities to raise awareness? Because one of the things, I'm from UNICEF, and we worked within countries. We went to about 12 of the highest burden countries to say, well, what are the issues? What is preventing these countries from scaling up? And even one of the things that came out in a number of countries, lack of champions. Lack of champions to talk about this issue. Lack of people to tell their personal story and to say, it happened to me, I don't want it to happen to somebody else. How do we stop it? So as a young person, I entreat you to take this up.
Thank you very much. Unfortunately, we've run out of time. But just to bear in mind, talking about young people, about 7.3 million adolescent girls below the age of 18 give birth every year. And reaching out to young people then becomes very critical, not only as beneficiaries, but also as active agents for change, as she said, in terms of demand creation. Also around issues of advocacy, perhaps. There are laws and policies that we need to make sure are addressed. There are issues to do with funding and resources to make sure that programming around the Every Newborn Action Plan is seen to fruition. Anyway, thank you very much. I'll hand over to our moderator. Let's give Dr. Kim a hand.